So you had two bad knees. They both had close to bone on bone, but you didn't really want to have your knee replaced, right?
Correct.
So we scoped the one knee on the right. Then we put some of your stem cells with some bone graft into a little bone cyst. That knee did pretty well.
Right.
So you actually came back and we just did the left knee.
Right.
How long ago?
August the 11th.
Okay, so we're in early October, so that's a few months ago. And you're walking pretty well. Like at rest, when you're sitting, you don't really have much pain at all.
No pain.
That's pretty good. And your motion's good. Use a walking stick when you're walking.
Yes.
And since the inside of the knee is close to rubbing bone on bone, you got a little walking brace
Yes.
like Joe Namath. And let me see you take a few steps. So you're kind of glad you did it. You've avoided a big surgery, right?
Yes.
And you tell
No knee
people they might
replacement.
consider that if they don't want to get a knee replacement,
Yes.
right?
I would highly recommend it if you don't want a knee replacement.
All right. Well, thank you very much.
You're welcome.
All right. So normally